So where we currently are at the moment, we've come out of that triple phase in terms of direct referrals, and we're back to normal ground now. We have held off with outreach a little bit over the past few months, and we're seeing that reflected in the numbers. So currently last month we had 87 referrals, and that brought our totals up to 1,644. As you can see, the national average again is still at around 51, 52 cases per month. We're a lot higher than that, and this has also been reflected in the national picture as well in terms of health and wellbeing. So when we break it down by organisation, we've had a tinker with the results and included primary care, the ICBs as well, and incorporated everything as one. So Merseycare and Liverpool University hospitals are again our biggest referrers, followed by St Helens and Knowsley, then Mid Cheshire and Alderhay after that. As we look at the numbers in terms of where we are by month, on a month-by-month basis, it's Merseycare and Liverpool University hospitals again who are reaching out more, followed by Liverpool Heart and Chest Hospital, Wirral University Teaching Hospitals, and then Bridgewater and the Countess as well. We don't show anything less than 5 because we want to protect client confidentiality. But what we can do is if you do want any further information on this or also this slide, let us know and I can dig in the system for you and I can send that to you directly without putting it in a public forum. So as we look at roles, in terms of where we are, the highest referrals from last month was qualified or trainee nurse or midwife, which has actually gone higher in the ranks. And this, when you theme on a thematic approach, when you look at this is a lot of stress due to the strikes that have been happening. That's closely followed by training of qualified AHPs, and then care assistants, other non-clinical support role, qualified training doctor and consultant. That has gone low because that's usually high on a monthly basis. But we've been linking in with practitioner health who do somewhat similar to what we do, but just for doctors and managers. And they're finding a lot of people are coming through them, and their wait lists are getting higher as well. So we're thinking in the next month or so, them numbers will reflect differently in terms of where we are. And then that's followed by managers or senior leaders, and then social care support roles. The other category does also include social care, but it's that breakdown of the other role. So in terms of referrals outwards, where we are with the hub, we've referred 21 nurses and midwives, 9 doctors, 5 managers outwards. So that means we provided local support for them in the local area, for example, and then followed with other clinical staff and non-clinical staff. These have gone to their local area. So, for example, if someone from the Wirral referred into us and wanted more local support, we'd look to more local Wirral aspects and pathways for them. In terms of Judy's aspect, so Judy is our pathways advisor at the hub. She's basically like the human form of the CAB. And last month she dealt with 6 different cases, and this could be around housing, debt, finance, social engagement, anything non-clinically related. We have a partnership with our third sector partners, and we link in with them to get people the relevant help and support as well. Relationship support, you may have noticed it says 0. That is because the current contract, what we had with them, expired at the beginning of this month. So the people who was on the waiting list have just completed their relationship support. And at this moment, we're not offering any further relationship support package to clients. We are working with Relate to get something in play, but this was because it was a national contract, which the NHS England team set up, and then got passed to localities. and they set all the regulations. So we are currently working with Relate to get some sort of relationship support back in play. But until we get this, we can't take any more referrals. Once we do get this, we'll be in touch with people to let people know and also showcase what the new package will be. So that's it in terms of our stats of where we are. It's been a busy month. We've been focusing on getting our assessment numbers down and also getting people seen a lot quicker in terms of our guidance rates. But we do have a few updates from the hub, and I'll just talk you through these now. So we've been, for the past 3 months, we've had a really successful sleep group. This was focused around sleep hygiene, sleep therapy, staying asleep, that sort of type of thing. And it's all psychologically informed, and it was run by one of our qualified clinicians. This has now actually come to an end, and the team behind have been working on a new formulated group, and we need to rename it, but it's going to be around CBT skills. And this is just general stuff for people who want to enhance the skill sets and whatnot at the same time. But this has to go through our governance meeting, and that is next Friday. So once that's signed off, that we can actually start rolling out the PR, the marketing, that sort of thing. So I'll be in touch with everybody just to let you know what's involved in this new CBT group that you can actually share out to and referring on behalf of your clients, your staff. I've just mentioned it about relationship support. We currently have no package, and we have a lot of people getting in contact with us asking if there's going to be any extras. So we know there is a demand there. We're just waiting on finances and whatnot being sorted out. Obviously, the new financial year starts in April, so we'll hopefully have some sort of pathway in place as well. Wellbeing events, it says now finished. That's a bit of a lie because we have one more event, and that is happening tomorrow. So if you or anybody you know wants to attend the last wellbeing event, do let us know and I'll send you the link. It's on our Eventbrite and on our Twitter and website as well. The reason we've stopped running wellbeing events is because we recently did a partnership scoping exercise and find that organisations run their own internal things. This could be yoga, this could be having a masseuse come round. So what we're trying to do is put the money, because it's public money, we don't want it to be going to waste. So we're leaving organisations with the help of us to run their own wellbeing events as well. But we're then putting the money to more useful resources, which then also brings me on to the workshop aspect. So we are currently running 2 workshops a month. This is self-care for individuals and also self-care for teams. And what we're trying to do is get a lot more workshops together, say around women's health, the menopause, that sort of stuff. But so what we're doing is we're recording both workshops and we're going to alternate them. So one month will be an event on Teams, the other one will be a webinar. And then we're also bringing back our burnout workshop as well. There's a big demand for this, so that is coming back on the 24th of April. And I'll share details in the roundup email with the minutes as well. So we are looking to get more workshops up and running. So this is why we're having to alternate it, because we need the staff to facilitate. And once we've got them up and running for, say, at least 3 sessions, we can record them and then get another workshop and have a full package of different workshops happening back and forth on a month-to-month basis. The website is currently going under a bit of construction at the moment, and it's becoming less COVID heavy because, as we know, in inverted commas, COVID's finished, we're done. Actually, we still need information about COVID, long COVID, but the website is going to be less COVID heavy and more focused around general health and wellbeing, and also a lot more things to do with self-help. I've recently updated the website with lots of free apps that's available, done a bit of a scope, and also put things like the Joe Wicks free package on there as well, so people can be directed straight to that. That's it from the hub, essentially. Like I said, it's been a busy old month. Our outreach numbers, we've engaged with over 500 staff members around the patch this month. which is a 112% increase on last month in terms of engagement and outreach. So we're here, there, and everywhere. We do have minimal events booked in for April, so I'll be in touch with people just to get things in the diary and get us over to your organisations. I'm going to come to partner updates now. At this point, I'm going to stop the slideshow though, purely because I can't see anybody. So stop that, and then I'll come to everybody else. So there's a massive thing in the chat, and that's from, oh, bear with me. Right, there we are. So I'm going to come to Jane for partner updates.
Okay. So probably similar to lots of other people, Lee. Really busy. As you said, you've already mentioned the strikes have really impacted on the workforce as a whole, really. And you've probably seen on the news the doctors have just announced a 96-hour strike over April. So obviously the support around that. In terms of general well-being, so we're continuing with our monthly newsletter, which is really well received, and we kind of link what you send into our monthly newsletter as well. So that's really well received, and we couple that with a kind of face-to-face well-being Wednesday once a month as well. And we try and have someone else with us alongside that, whether it's NOS or counselling services or someone talking about veterans or whatever it is. So we continued with them. I think I've mentioned a few times about our wellbeing hub. So we'd identified a space. It's taken us much longer than we hoped to get that up and running. But I went down yesterday and it's painted and carpeted and it's got furniture in it. So we're just doing the last nice little bit. So that'll be great then, because we'll be able to host the likes of yourself, Lee, to do different sessions and things. So we'll get our timetable up and running. We are continuing with our health MOTs. So we had some non-recurrent money. So this year, our aim is to offer every member of staff a health MOT. So again, they've been great, and the company who are doing them have been in a night. They were in ITU a few nights ago. They're going out into departments as well as holding some central kinds of sessions as well, really. And then similar to yourself, so we've got a session today on an online session on sleep, and lots of different kinds of a mix of face to face and online well-being type events, really. So yeah, I don't know about others, but it kind of feels like for the first time since COVID, we're really getting back into the swing of things. So yeah, long may it continue, really. I'm sure I've
It's
forgotten loads of stuff, but they're the main things. Yeah.
no, that's perfect. It's a great little aspect when you start to realise how far the wheels are moving in motion and getting stuff organised. It's really good about your wellbeing room as well. So keep us updated. We'll
Oh
happily
yeah, I will
come
do.
by.
No, you're definitely on my list. Yeah.
I'll try. We're running out of freebies, so I'll try put some aside for you.
Oh, don't worry.
Brill. Thanks, Jane. That's super insightful. Thank you very much from the Walton Centre. I will come over to uh, Danny and Roberta. Do you want to do yours together or do you want separate stuff? Because I know you're different organisations, but same if
I'm
that makes sense.
I'm going to let Danny speak because I need to jump onto another call, but I
Not a
trust him
problem.
100% to say the right things. Nice to see you all.
Thank you.
Bye.
No pressure there. Yeah, not kind of like masses to update, just a couple of bits that I'll mention. There's a couple of people on the call that I've not met before, so just to say, my name's Danny. I work for MSP, which is Merseyside Sports Partnership, and we're the active partnership for Merseyside, as the name suggests. And Roberta, who's just dropped off the call there, is kind of like my counterpart for Cheshire. So we work at a strategic level to promote sport and physical activity, and we released an ICS strategy for physical activity called Altogether Active, which we launched back in October. So loads of stuff going on with that. We helped to organise something called the NHS Games that the vast majority of trusts in Cheshire and Merseyside are signed up to. So we've released our like program of events and things that staff can get involved with this year. I'll pop a link in the chat in a sec for those who haven't seen it before. So I think lots of promotion going on with that at the moment. We, for the first time between January and March, ran a step challenge for staff to get involved with. It was the first time that we did it, so we weren't quite sure kind of like how popular it would be, but we had just over 1,000 staff signed up for it. I think it was about 147 teams, and the last time I looked, which was I think about this time last week actually, there was 150 million steps that were logged. So absolutely incredible participation. Really importantly as well, a lot of the staff that took part weren't already active. So it's not just the sporty people that were engaged in this. It is designed for absolutely everyone. So that was really good to see. We're just collecting the feedback from that at the moment that we can share once we've got that. And it's great to have, I know Keely's on the call, it's great to have Keely's involvement in the games this year as well, hoping to sort of like better promote and get more women involved in the football. So we know that last year England won the Euros in the summer, and that really sparked an interest in women's football, which we tried to do a couple of years ago without much success. But I think with Keely and her colleagues helping that this year, we're going to get a lot more engagement, which is really good. So I'll pop the link in the chat just for you to have a look at in your own time. I know most people on the call are probably already aware of it, but just if anyone's watching the recording or anything, I'll do that. We're involved in the NHS Prevention Pledge. So I know there's a couple of trusts coming on board as part of phase 3. So I think I saw like Rachel on the call, so that the women's is part of that cohort. So in the next couple of months, we'll be sitting down with whoever's kind of like the leads of that within each trust, just to work out to see what we can do to boost physical activity within the trust, and that's both for staff and patients. So there might be some individual actions related to each trust that come out of that. And then just a couple of other thoughts that I've had. It's probably more a conversation for you and I, Lee, but just would be interesting to get feedback from other people as well. You were talking about workshops there. I was just wondering maybe if there's something that we could do there around physical activity, just something really short, snappy that people could watch in like 10, 15, 20 minutes or something like that. And the other one was, there was a webinar this morning around talking therapies. So it was a national webinar, and just how physical activity can be built into that. And there's a couple of examples from, I think it was from Camden and Birmingham that were presented. That sounds like the one, Lee. Yeah. So that's, just wondering, maybe I've forgotten. Apologies. Does the Resilience Hub employ therapists or counsellors?
Yeah.
Yeah. So just wondering maybe that there might be some actions there that we could get those staff a bit more upskilled on, so that they can build physical activity into some of their conversations.
Absolutely. That link, what I've just put in the chat from Sport England, was what Danny was just mentioning as well. I shared it with our team this morning. But it'd be really good to touch base with you in terms of the workshop aspect, because I know we're trying to get a lot more self-learning type workshops, webinar things happening. And I'm looking at all the premieres like YouTube, watch parties, all of this sort of stuff, so we could get more people engaged on different platforms, and also meet the needs of, instead of being a 9-to-5 service, actually outside of them times at the same time. So I'll happily touch base with you and let you know.
Yeah, definitely. And then just quickly, because Roberta will kill me if I didn't say, we're still piloting the MEC for physical activity program at the moment. So we've had 2 workshops already this week. One that was kind of like a bit of an open session on Monday, and then on Tuesday we did one with a cohort of Merseycare staff over in Knowsley. So again, once we've got the sort of learning and evaluation data back from that, happy to share it with the group and then look at how we can expand that in future as well. And that's it for me.
Thank you very much. Judy's sat across from me, by the way, so I've got an echo, so I was just asking if people are frozen, because our internet is playing up in the base. Yeah. So if I do freeze, I am still here. Brilliant, thanks, Annie. I really appreciate that. If you send that information through, I'll pop it in the newsletter as well, and I can show it out I've pushed out the Women in Sport and also the NHS games on our Twitter and in our newsletter as well. So hopefully you will get some uptake on that. And if you need any further support or whatnot, we can help you that way if needs be. Smashing. I don't know if it's just me. Has Keely froze?
She's frozen. I've just found her.
Okay. I didn't know if my computer was going mad or not, but there we are, cracking. Right, I will come over to Rachel Cowley. I see you typing. Caught you.
Caught! Caught! No, yeah, so Liverpool Women's, what have we been doing? So there's been a lot of activity around our menopause club. We've had another club meet, so they're meeting quarterly, and we've been asked, as this is a club for our women where we have our two specialists from the hospital, so Dr. Paula Briggs and also Kathy Cook, one of our nurse consultants, who lead on this and do brief consultations at the end of the session. They then write out onto headed paper for each of our staff who've attended that. Is 5 to 10 minute brief consultations with them, a treatment plan that people take away with them to the GPs, and it's been really, really successful. So we had another one of those recently, and we've got dates for the rest of 2023 in. But we've also had a request to do one for our male colleagues. Now we are, I know probably all NHS organisations are predominantly more female in the workforce. We're quite heavily female in the workforce because of the nature of our work. 90% female, 10% male, but we've had a request for our males, quite a few of them, that they want to know more. Obviously, males have family members, colleagues going through it, but also may also line manage. So we're progressing that piece. And I'm going to ask if we can record that as well. And if we can, share that with this network so that you guys can also use it within your areas to support your male colleagues by a video webinar that someone can watch back at a time that suits them. Doing a lot of work around our plans for 23-24, so physical health and nutrition. So Danny will be back in touch with you again, very much so. Really want to drive this forward as we're coming out of the COVID period. It feels it's the right time now to be able to do these things. We had quite a lot of restrictions placed on our staff that meant, unfortunately, we weren't able to get involved with Danny's stuff as much as we would have liked in the last 12 months. But now is the time, so it's very exciting. So we'll see where that takes us, that pillar of work. And we fully launched earlier this year our support for staff, which is around mental well-being and trauma informed support. So we've got a consultant-led consultant psychologist-led service. So recruited Dr. Emma Evans into our team, reporting into me, who is a trauma specialist, and she's starting to develop the trauma-informed culture for our organisation, training packages around that, which we hope to be launching in the coming weeks and months. And we've started to take referrals in-house from our staff, and it's interesting the amount of support this team has been able to do. So I look forward to seeing what the impact that will have on sickness absence moving forward. Lots of other things going on as always, but I think for us that's our main focus that's been happening recently since the last call, and what's happening in the coming weeks. And as I say, I would like to keep an eye on how things are going. Most of you'll know from an email from Lee, I'm actually exiting the organisation. I'm going working at Royal Cornwall Hospitals Trust. Always had a dream to retire down there, and unfortunately I'm going to work down there, not retire, so I won't fully enjoy it, but no, I'm sure I will enjoy it. So and a promoted post, so I will miss everybody, but I hope we can keep in touch as a network.
Well, thank you. I was going to introduce you and then be like, oh, have you got some news to tell? But obviously I've already emailed everybody at the same time. Brill, thanks Rachel. The male menopause stuff will be really insightful because we get a lot of questions, and it's something we can, if it's recorded, it's something we can push out for you guys at the same time.
Yeah, and I've asked if the future sessions can be recorded that we do as well, because what we do is we have a, no pun intended, although maybe there was, hot topic at each of our menopause clubs, and we have someone, we try and have a specialist speaker come in and talk about that hot topic as well. So we've had someone talk about diet and menopause. So I'm going to ask if future sessions at the beginning part of the club even when it's just for women, can be recorded, and we've just closed
Yeah.
before the question section on the recording, just so that that can all be shared, because it's all really valuable information. And I just think we've got that at our fingertips. We should be sharing it with everybody.
Yeah, absolutely. And we can host it on our website. We can signpost direct to your website type of thing, so you get the traction as well. But yeah, keep us updated. Sounds really really good. Thank you very much. I will come over to Jane over at Luft.
Thanks, Lee. No kind of huge news to report from our side. Probably the biggest challenge we're facing at the moment is about our wellbeing space. So as we sort of settle in and reconfigure following the move to the new Royal, we have found ourselves squeezed out for the moment. And one of our challenges is continuing to lobby for some wellbeing space that is fit for purpose. So that's keeping us busy at the moment. I think our other biggest intention remains integrating as much as possible between wellbeing, freedom to speak up, HR, OD, and that's coming together, I think, effectively on a number of different initiatives. We're particularly thinking about more trauma-informed working environments at the moment. And I think the final thing is we've got a couple of trainee clinical psychologists on board to do their doctoral projects with us. One on trauma-informed care, and the other on staff views of seeking help for their own wellbeing.
Real, that's I was working with I was linking with Sam in terms of your wellbeing room. And we were saying about how interesting it is trying to approach the trust to say we need some space, we need to do this, and me and Sam were talking about how we could integrate and help each other. And I've said, and I'll reiterate to you as well, if you do need any like a letter of support from us, we can give you the insights in terms of referrals outwards from your staff members, so we can build a business case together to say this is very much needed. Because much like yourself, we have the psychological insights and the thematic analysis of everything that happens behind the scenes, so we can provide a help towards the business case if you need.
Brilliant. Thank you very much indeed.
No worries. Thanks, Jane. Sophie, I don't know if you're there, but you froze on my screen. Oh, you're back. Over to you.
Okay. Am I frozen or am I okay?
No, you're back now. You
Okay.
froze. I tried Teamsing you just to see if you were still there or if you'd gone or not.
Okay. Hi everyone. I think my update will probably be similar to last month's. Obviously, we've been really busy supporting the strikes, but we have continuously been adding to our financial wellbeing offer. That's kind of a really big focus for us. I suppose some of the other points I just want to maybe focus on, because kind of Cheshire and Mersey kind of could maybe link in. I'm hoping to link in with you, Lee, to see if you could help us with some of these. So we're planning a Wellbeing and Art Week in May. So we're going to get sort of printmaking, a poet to come on site, origami, loads of different things regarding art, because it's a focus on art in May. So we're looking to incorporate that and hopefully get Cheshire and Mersey Resilience Hub to come in and promote your services as well. And we're also looking at planning our summer event as well. So they're sort of the main things we're focusing on at the moment.
Real. That's I love art-based therapy because it could be
Yeah.
anything and there's no wrong answer. Because it's art, isn't it? So what's right to you could be wrong to somebody else type of thing, and it doesn't matter. I love that. Yeah, happily get in contact. You need any further support, that sort of stuff, we'll happily help with that way. And just whilst you were saying that, I'm also looking at planning a wellbeing week of events, online events for all staff that I need to signed off, so I can't tell too much until it is signed off. But yeah, if we could incorporate anything like that, then yeah, definitely we will be here to help.
Thank you.
Smashing, thank you. Keely, are you there? No, doesn't look like it.
I am here, sorry.
Oh, okay,
It's,
no worries.
very, very slow internet connection at the moment. So apologies.
It's up to you if you want to give a verbal or if you want to put it in the chat. I can pop it in the minutes up after. It's up to you.
My update was just a quick one. Sorry, I'm just in the main office at the moment, so I'm just whispering. It's very quiet in here, as you can tell. So yeah, just in regards to what Danny was saying, I've got a survey that's out at present. There's been a survey that was set up by the team here at MIA, and there was two done. One's got my email address attached and one's got Pam. So I'm just going to make sure we've got the right one going out to the right, or we've both got collecting the responses, because I can see there's 7 responses that have come in, but I think that could be because that's the test survey. Now, I know you sent an email the other day, Danny, in regards to whether is the survey live and good to go. I think it is. I don't think we had any other questions in regards to the survey. It had been on there for quite a while, hadn't it? So when we had the initial meeting. So I think, it's just getting it promoted really now. I know we've done a poster and that was verbally signed off in the steering group meeting. So I guess it's, how can we really maximise getting this survey out? Now, the survey and what it's about is, as Danny mentioned, NHS Games are trying to encourage women to play football. Previous years, there's not been one female team entered, and to do this survey, what we're trying to do is determine why, what are the barriers for preventing women from entering football. So that's why we wanted to do it, because if it is about, well, I've not had any previous training, or it's accessibility to opportunities, which is what it's showing on this small sample size. If we can agree across different places to set up training centres, like you're on about the workshop, if we can do a training centre in each place, there's an opportunity then for ladies to try it and see if it's for them. And then the more people from each trust who start to talk about, oh, on a Wednesday evening, did you know that at such and such a place there's going to be, it just helps. And as we've all said on this call, physical fitness, that team, building outside of work, not just during the core hours, makes a massive difference. And I think it has an impact inside work and outside of work, especially if you're doing it with your colleagues. There was something I wanted to ask, which isn't directly linked to this, but just in regards to your slides, Lee. We're experiencing an increase in pressure in A&E, primary care, the calls coming through, 111. Is there some common or themes, or is there a higher prevalence around certain themes, that you're seeing through this service? Is it, relationships? Is it to do with children? Is it to do with, is it work related, financial? Is it health, mental or physical? Because when you were talking, Jane, around health MOTs, I think again it's trying to understand what is happening across the demographics. Well, we know intuitively, we know, but what is the most prevalent cause of concern for people thematically?
So
If we can start to build that picture.
in terms of this, I'll just give you a bit of an insight. Just pull up another presentation I deliver. So let me just share the right screen with you. So this here is a presentation of which I give to organizations to let them know. There we are. Let them know who we are, what we do, type of thing. And there's 3 big circles on what we work on, for example. So the dark purple circle. Can you see my screen, by the way? I've lost sight of everybody.
Yeah, I can see. Yeah.
Okay, brilliant. So the dark purple circle is the main thematic approach, is what come through the hub. So it's around burnout, stress, anxiety, low mood, worry. And then you've also got the green circle, which is incorporated into that part of it at the same time. But these are more organizational stresses. So workplace stress, organizational changes, going back to kindness and civility and back to basics, increased workloads and not enough staff. And then there's also a national picture from what, not just the hubs, but other helplines, for example, like the Samaritans helpline. During the actual pandemic, there was 2 phone lines set up, one for NHS staff and one for social care staff. The social care staff wasn't used nearly as much as it should have been, so they merged both together. And from that, they had 18,000 phone calls. And the thematic analysis showed that it was like around loneliness, abuse, physical health, relationship problems, family issues, isolation. But also from that, and a bit sad news, but all from the longitudinal studies, if you would, there was 20 NHS staff members in the UK who took their own lives because of all of these issues. So That phone line has now been amalgamated into a text service. So it's powered by Shout, and it still goes on, and staff members can text say frontline to 85258, and I'll send that out in the information as well. But in terms of a thematic approach, these are the main factors of what we're understanding. And where we get that information from is linking in, say, with the national NHS team, the Northwest NHS team, looking into organisational staff absence and sickness around depression and anxiety, staff turnover rates, and also things like staff survey results as well. But it's also partner forums like this, wellbeing leads and speak up, freedom to speak up guardians, as well as registered managers meetings. So there's a lot of information within that, if that makes sense, as one aspect, but there are so many different themes which need to be more, is it a local, is it national? And this is
Yeah,
stuff that we're
exactly.
working on with the national team. I know the 22 staff survey results from 2022 have just gone live recently, and I've
Right.
just been looking into some of this. Now, this is in my presentation, so bear with, because it's relatively small, so I'll try zoom in. These are stuff here in terms of organisations, say around staff morale, and it's scored on a 1 to 10 basis, but also the green is the best, the blue is the average across the board, and red is I want to say it's categorized as the worst, but it's not, because that's the wrong terminology to use. So these are all the different organisations that we have within the CNM footprint, and this question is just based around morale alone. Now, there's a lot of work we can do to organisations, but within their own organisations, they have their own things that they need to be focusing on, say staff engagement, understanding why staff are feeling burnt out, or why morale is low. So this is something that we're going to be looking in with organisations. Jude Heaver from the Northwest team at NHS, she's on leave, but they're currently doing a piece of work for the ICB, which understands, and it's a deeper dive. So once we have that information, we can actually share this out wider for you. But it's also the stuff we have here. So this question is around burnout. Again, all the organisations that we have across the footprint scored 1 to 10 on the best, average, and invert commas worse. And it's not an aspect to embarrass people. It's an aspect to work in and link with people. And the different colours, bars, just relate to whether they're acute, trust, whether the community, mental health, that sort of thing. But then there's also other questions at the same time, which I've been looking into, and I don't want to deep dive too much into this because I want to wait for the proper report. But again, this is like stress factors of why morale is low, and again, different organisations at different levels, and then also staff members that are thinking about leaving. So there's a lot of work to be done. I don't want to step on organisations' toes around this, because there's so much that we can get from it. So once we get the national report, the Northwest report from the team, what we can do is we can link in with the organisations to find out what it is their local thematic approaches are. That was a very long-winded answer. So there are themes we have on themes we are linking in with different organisations, but there's also the wider picture in terms of organisational aspects, such as the staff survey results. Does that answer your
Brilliant.
question?
That's really, really informative and helpful. Thank you so much.
No,
It's great to know that piece of work's going on.
It was going to be at my end of the presentation, but because we don't have that many participants, I thought I'll get in touch with everybody else around this. Jane, you've got your hand up.
Yeah, thanks, Elisa. That piece of work is fantastic. Thank you. And certainly from my perspective, don't worry about stepping on my toes, because we're only small. So actually we don't have that resource to do that piece, that kind of really deep dive. So it's basically me along with everything else I do. So we tend to just look at our organization and we do a little bit of comparison, but we tend to focus internally because that's all we've got the resource to do. So I would absolutely welcome seeing some of that, Lee. That's brilliant. Thank you.
Not a problem. I was trying to navigate all the NHS staff survey results, and I had to go through every single organisation.
Yeah.
What I didn't want it to be is, well, we're better than this, and we've got that, and because we're all in the same line of work, and so to find them 4 slide, well, then 4 charts took me about 6 hours to
Yeah.
navigate through the whole of the stuff. So I'm letting the NHS team. I know we've got a bounce back off Jude and Karen, who's the head of staff wellbeing at the Northwest team, has messaged me to say this is happening. So this is going to Chris Samosa at the ICB. So once we get the information that's freely available, we can link in and work with organisations to say, hey, your engagement rate's a little bit low. Here's how we can help. This is what you can do, and so on and so on. But we'll need, I want to say, buy-in in inverted commas from all the different organisations, because it helps everyone if everyone's engaged at the same time. But I don't want to share too much information on that because it feels like I'm putting organisations against each other. Hence the terminology where they've put it on as worst. Nobody's worse. It's just the national average aspects. So essentially, that does bring me to the end of our presentation, the PEF meeting. But I do want to just let you know that we are linking in with different organisations to understand their needs in terms of the thematic approach. So, for example, the Women's has recently employed Dr. Emma Evans, and they're doing a lot of assessments that way. So it'll be great to understand. I know Jane's one of the psychologists over at Luff, so it'll be great to understand their themes at the same time. So once we actually get that information available, we'll link in with different organisations and run a partnership scoping exercise as to what's happening across the patch where you guys might need a little extra help or support. I just also want to mention that I was meant to have a meeting with the ICB on whatever day this week. I don't even know what day we're on. But whatever day it was this week, but we've had to rearrange that. And I am going to be asking the question about this forum, because what used to happen was there was a health and wellbeing meeting before I started. Then I started, and we had a clinical oversight group, which wasn't very clinically or not oversight. It was a meeting for an hour where we talked to you about our stats, and it didn't work. So I merged it into what is now this partnership engagement forum. So I'm going to be tapping them up to see if they want to take the health and wellbeing or PEF or whatever forward, and that they lead it from an ICB level, and then we just have an insight and give you updates along the way. And then hopefully, because I've had a lot of people say on a Thursday it doesn't work for them because they work part-time or they can't attend because they've got this. So if we can put some within that partnership scoping to find out what works for you. Is it a Friday morning? Is it a Monday morning? And so on and so on. And then we have it either once a month or once every 2 months, because I know we're all busy trying to get that information together and whatnot. So once that actually happens, I'll share that information with everybody as well, if that's okay. Does anybody have any queries or questions? Judith?
It might
You're
not be
muted.
relevant at the time. Just bear with me.
I was just wondering whether, apart from the work that we do with the trust as such, it might be useful to have information around the police and our work with the police and how useful it has been to go out and visit with the HQ location in Rose Lane and also the operational command and the feedback we've had from the police.
Yeah, that's not a problem. So we do originally on the original invite there is Merseyside Police and Cheshire Police. We have had bounce backs from them today because they've got stuff going on. But it'd be really good to share insights in terms of numbers from where we've been with the police, and give you guys an outside input, if that makes sense. Because it's not just how NHS work, it's also social care, who I'm really trying to tap up and get some representation at this meeting for as well. So I'll share that once we get that.
Thank you.
Any other queries, questions, burning desires? Smashing, not a problem. Well, thank you very much, everybody. That was a nice, I thought it was going to be short, but that was a nice, nice, insightful meeting.
Yep. Thanks, Lee.
No worries.
Good luck, Rachel.
Good luck, Rachel.
Oh, thanks very much.
yeah.
I think I probably have another meeting before I go, but
Ah.
thank you. I've really enjoyed this network, and I'm just going to be sad to leave.